안녕하세요.
Hello, I'm Professor Yang Seung-min. As implants are getting popular, functional and aesthetic requirements are getting higher, especially for the upper anterior implants. Aesthetics is considered as the most important barometer for the success of implants, not just simply placing it, but forms and color of gingiva and the harmony with the natural teeth are not easy to achieve. Here I'm going to introduce aesthetic implants. The contents. First, aesthetics in maxillary anterior region. Second, for aesthetic implants, factors to consider. 3 of them. First, preoperative evaluation. Second, accurate implant placement. Third, forms of prosthesis. And summary. What is aesthetics in maxillary anterior region? Let's have a look at a clinical case. In terms of prosthesis, there is a difference in the margin of prosthesis and natural tooth. So you need to make it similar to the margin of adjacent natural tooth. That is the goal of achieving in the maxillary anterior region. You can achieve it through implants or prosthesis. If you look at below, there is a fistula. Because of that, the tooth is extracted. And if you look at the restoration of the tooth compared to pre-op, the interproximal area, the height of interproximal area is quite considerably reduced. Apart from it, others look okay. Harmony with the gingival line looks okay. The upper photos, when there is no lesion, and when we make prosthesis, and when we make prosthesis where there is a lesion, there's a difference. What we know is different from what we can do. There are some things that we cannot avoid even though we know about it. How can we avoid it? And how can we maintain the situation? In order to understand it, we need to think about the factors affecting aesthetic zone in the maxillary anterior. We are emphasizing smiles. When they smile, the visible part varies from person to person. Lips outline the mouth, and the gingiva and teeth are inside. The visible parts differ. When the smile is high smile, a lot of things will be visible. So we need to understand them. Components of smile, the dentition, lips, and gingiva. There is white and pink aesthetics. Yellowish is the color of teeth, but it is represented as the word white. And gingiva is represented as pink. So we can divide the aesthetics into white and pink aesthetics. When we look at implants, we need to look at the shape, size, location, proportion, tones. They should be similar to a lost tooth in the upper anterior region to achieve aesthetic prosthesis. White aesthetics, it's primarily related to teeth. As I said before, it should be most similar to the lost tooth. in terms of these, and emergence profile should be proper for an implant. Pink aesthetics refer to gingiva and lips. Gingiva is in pink color, whether the gingiva has appropriate keratinized tissue, if the contour is in harmony with adjacent teeth. As we saw in the case before, if the interdental papilla is appropriately formed, the dental papilla is properly recovered. So these determine the pink aesthetics. In order to achieve all these goals, as I said before, these three are important. Diagnosis and treatment plan. Based on that, surgery is performed. And lastly, we need to do the prosthodontics for successful aesthetic implant restoration. Before we do surgery, what do we need to evaluate? First, the implant site, hard tissue and the soft tissue, whether they are damaged or maintained intact. First, we need to identify the amount of bone defect, bone loss. Second, the quality and quantity of soft tissue. Third, harmony with cervical area of adjacent tooth, whether there is a gingiva recession or there is huge damage in terms of vertical bone loss. And we need to think about the shape and height of interdental papilla and the patient's, whether the patient has normal smile line or high smile line, the type of prosthesis. These need to be evaluated. So overall, aesthetic implant prosthesis needs to be achieved, and there are conditions. First, the soft and hard tissues need to have proper shape. Second, implants should be positioned appropriately. Otherwise, there are limitations what we can do with prosthesis. We will make decisions regarding these later. This is very important, and this can be subjective. We need to analyze the patient's aesthetic expectations. When we have a consultation with the patient, we can easily miss this. For example, if there's a lot of gingiva recession in a patient and there is a lot of loss in the interdental papilla, but if the patient wants the recovery of those as good as young people or entertainers, it's not something we can do. So if a patient wants that with high expectation, we need to analyze them and tell the patients what we cannot do. Even though the prosthesis is highly successful on our part, that may not be able to satisfy the expectation of patients. So we need to analyze the patient's aesthetic expectations. Based on smile line, we make the decision based on that. And we also need to analyze the shape and color of the lost teeth. Based on those, we can determine what can be satisfied in terms of the patient's expectations. This can prevent problems that may arise in the future. Based on that analysis, accurate treatment plans should be established based on hard and soft tissues, and the implant should be placed accurately. And we need to achieve optimal peri-implant gingival interface and contour of the future provisional and definitive restorations. As I mentioned before, we need to identify the needs of a patient. Smile type, how much gingiva is showing. For example, on the right-hand side, if the patient has gingival recession at 11 or 12, and the patient wants all the recession to be covered by the treatment, you need to determine whether you can do it or you cannot do it. Based on that, we need to come up with accurate diagnosis that we can discuss with the patient. And we need to look at the tooth shape, whether it is a square type or triangular. There is a difference in terms of recovery of interdental papilla based on the shape. We also need to discuss it with the patient about the future treatment other than implants that may be required. So we need to consider those for diagnosis. Aesthetic triangle. Based on the current situation of a patient, we need to evaluate hard tissue and soft tissue, and we need to think about the prosthesis based on that. We need to consider all of them to achieve aesthetic outcomes that we want. If any one of them is missing, the outcome would not be very good. So let's have a look at a clinical case. On the left and right, the initial status is quite different. In the left, the contour area is higher than the surrounding area, the number 12. But on the right-hand side, at number 12, there's lack of hard tissue and soft tissue. So we need to check what would be the optimal result given the situation. If you think you can recover the interdental papilla and make the tooth look like very natural and tell that to the patient, the outcome may not be as you expected because there are things that we cannot do. Therefore, first, based on the aesthetic triangle, we need to evaluate hard tissue. The bony contour should be evaluated considering the surrounding area, ridge crestal height and thickness of the labial side bone. The hard tissue should be evaluated. If necessary, augmentation should be done. And if you evaluate hard tissue, here you can see this will dictate soft tissue appearance. If you look at left and right, by looking at soft tissue, we can expect what hard tissue would be like below there. If you raise a flap on the left, the bone height is not a problem compared to the adjacent teeth. But if you look at it closely, there is a bit of bone loss in the interdental papilla area. So you need to consider that. The future interdental papilla, how it will be formed in the future, can be expected or evaluated at the beginning. On the right photo, in the distal of 11, there is damage. Considering that, even though we do our best, there are some things that cannot be done. So in the future, the shape of prosthesis is like this. If a patient loses a tooth and does not mind the treatment that I'm going to discuss now, on the right, number 11 could have been extracted, and the interproximal bone height could have been moved cervically so that we could have made the result more aesthetic. But if you look at number 21, the gingival recession is severe. So in the future, number 11, prosthesis needs to be done again. In the left, there's a small exposure of interproximal area, but hard tissue and soft tissue is in harmony with adjacent teeth. In the future, you need to think about how to explain this to the patient. So, most importantly, you need to evaluate it before surgery. If you look at left and right, look at the shapes of teeth. On the left, it's a triangular, and on the right, the teeth shape is square. The shape of bone below the teeth and gingiva surrounding the teeth are different in these two, and we need to consider that. Now we use a different term. It used to be periodontal gingival biotype. Now it is called phenotype, but they refer to the shape. It's different words, but they are the same. If I use the old term gingival biotype, there are two types. Flat, thick, it means gingiva is thick but the contour is thin. And scalloped, thin. It is a scalloped shape and the thickness is low. So this is related to the shape of dentition. If the dentition is shaped triangular, scalloped, thin type of biotype. When it is squared, the biotype is a flat, thick. So this would determine the shape of gingiva surrounding area, and that is also affecting bone. To be accurate, supracristal gingiva interproximal height is different. In the mid-cervical area, the gingiva height is similar, but in the interproximal area, there can be difference in the height. Whether the interproximal area will be filled with gingiva can be determined by the shape of teeth and the gingival biotype. So these need to be evaluated before surgery. So based on that, how can we accurately position implants? During surgery, the evaluation results would be reflected, and the surgery should be used to place implants accurate for the optimal prosthesis. Number 31 implant is exposed. On the left, number 31 is implant as well. If you look at the surrounding area, it is not obvious where implant lies. The biggest difference between the left and right, of course, pre-op evaluation is very important. Based on the evaluation, accurate implant positioning plays a very important role. The implant on the left is placed very deep. Do you think that was intentionally done? I believe it was because there was a problem. So before surgery, that area could have been evaluated more stringently, especially in the maxillary anterior region. Here there is a smile, but this should be the result for recovering aesthetic smile. To do so, right positioning of implants is very important. There are many factors affecting implant positions: implant location, placement angle, placement depth. If you make mistakes on these, you can use prosthesis to cover them, but implant depth is very important that it may not be able to be covered by prosthesis. Buccolingual direction, mesiodistal direction, apicoronal direction of an implant should be considered. Generally, the outer edge of an implant should be 2 mm away from the bone. Mesiodistally, implant should be positioned with a distance between natural tooth and implant 1.5 mm at least. Apicocoronally, that's vertically, it should be placed 3 to 4 millimeters below the CEJ of the adjacent teeth. Based on the CEJ, 3 millimeters, 2 to 3 millimeters. 4 millimeters is a little bit deep, but it's not a problem. But usually 2 to 3 millimeters below the CEJ with a flap surgery. Without a flap surgery, we need to look at the margin. From the margin to the top of the implant, it should be at least 4 millimeters in terms of the depth. To secure the depth of implant placement, if you look at the direction, it is the same as the long axis of natural teeth surrounding area. Oculingually, it is parallel to the tooth axis. When you do the immediate placement, you can identify the tooth axis, but after healing of the extraction socket, it would be difficult to find the tooth axis. So instrument like a guide surgery or surgical stent can be used. Prosthodontics, emergence profile, as in the figure on the right, the abutment and the implant. The emergence profile goes concave at first, but when it comes out of the gingiva, it is convex, so it looks similar to English alphabet S. What is most important is that subgingival contour should be concave. There are many factors for emergence profile. As I said before, implant types, including diameter, implant placement depth, and the abutment, whether abutment diameter is smaller than the implant diameter or the same as implant diameter, whether it is platform switched or not, and abutment gingiva height would make difference in terms of the emergence profile. That would determine the shape of prosthesis. Let's look at a clinical case to summarize what have been explained. The patient had a perio disease and came to the clinic. There is a fistula at number 12, and calculus is accumulated, and no bone is expected in the area. Immediate implant placement is chosen, and the bone is grafted. Primary closure is achieved. After sufficient healing, prosthesis, the shape of prosthesis is devised. Placement depth and the appropriate prosthesis shape were delivered. If you compare pre-op and post-op, the below photos are pre-op. The gingival line compared to pre-op is maintained in a very natural way, and the shapes are improved. As I said before, the shape and the form of a tooth determine whether interdental papilla would be filling the gap or not. Very important. The shape of prosthesis is very important in that respect. It is essential to evaluate patients' clinical situation before doing surgery. And the basis is diagnosis. It is necessary to decide on which surgical approach is beneficial to a patient's need. This is the shortcut to realize the expectations of a patient. It is important to place at a proper position to get good aesthetic results based on the diagnosis. In the maxillary anterior region, which demand high level of aesthetics, harmony with existing teeth should be provided so that a very natural smile can be restored through proper procedures. I hope you would be able to satisfy your needs as well as your patient's needs. This concludes the lecture. Thank you for your attention.